Hello, everybody. Happy Wednesday. I'm just opening up the webinar, so we'll just wait a minute or a little bit here to make sure everybody has time to join in. Appreciate everybody attending. We'll get started here in just a minute. All right. Looks like we may have some few people join us later, but it looks like it's leveled off for now. So we'll go ahead and get started for today. Again, hello, happy Wednesday. My name is Jonathan Raish. I'm the current section president for the St. Louis Metro section of the Missouri chapter of the American Planning Association. I appreciate you all joining us this morning. Before we get started with our presentation today, I just want to give a few announcements for the section. First item that you should know about is the Illinois chapter of APA is hosting a chairperson roundtable with to help give some guidance to planning chairs, vice chairs, and others involved in those. So that is on April 30th, and information about how to join that or to have if you're a planner, to get your chair, vice chair, some additional information, and that information is on our newsletter from this past week. Let's see, also, anybody out there who is not currently serving on our local section board, even though the terms are a calendar year, we're already coming up on nominations for our 2025 board. So starting April 30th, if you're interested in serving on our board, there are 14 members, 14 slots open with ideally half membership from Missouri and half from Illinois. So if you're at all interested, keep that in mind that will open up on April 30th and will close on May 30th. There's contact information for all of our board members under the committee section of our website, which is missouri.planning.org. And then you go to the St. Louis Metro section. So if you have any inkling to get involved, please reach out to us and let us know. We're always looking for volunteers. So let's see, two more real quick. The AICP certification cycle for certified planner to become one is now open through the end of this month. So again, additional information about that on our newsletter and on APA's main website. And lastly, if you're part of an organization that would like to help the work that our section does here, we are always looking for sponsors. So if your organization is in a place where they could help sponsor our group and the work that we're doing, please reach out to us. Rachel Witt is our treasurer, or you can reach out to any of our board members. We'd be happy to give you information, but there is more about that in our newsletter as well. Thank you for bearing with me through all those. Now I'll get into the real important piece for today. So we're very, very happy and excited to have with us Sunny Hutton, who is a community organizer with deep experience in helping translate between technical experts and community residents with a focus on elevating community views and voices. She became involved in tenant organizing in 2018 when a bed bug outbreak occurred in her building. She organized with her neighbors to have a mass meeting, and they decided that no one will have to go through this again. So they adopted the Homes for All model and started Homes for All St. Louis, a coalition dedicated to catalyzing tenant association across the metropolitan area and improving housing quality. She's an education professional with a background in human and organizational development and policy. Let's see. So this she'll be presenting today on this topic, which is a comprehensive understanding of the code enforcement process and ecosystem for occupied properties in the city of St. Louis, as well as resources available to support low and fixed income residents in maintaining a healthy home. This information comes from the recently completed Health and Housing Quality Brief for the city of St. Louis, which puts forth recommendations for improving the code enforcement process designed with community and municipal government. The brief was done in partnership with Homes for St. Louis, STL Vacancy Collaborative, and the Building Division of the City of St. Louis. So yes, thank you. I see Sunny put some information there. That's great in the chat. And as we go along, before I hand it over to Sunny, I believe the Q&A should be active. If it's not, I will double check that. But if you have questions, hopefully we'll have some time at the end and I'll try to help moderate those. But everybody help me in welcoming Sunny. And Sunny, thanks very much. We look forward to your presentation.
Hi, y'all. Thank you, Jonathan, for the introduction. And I'm really excited to be doing this. This is like the first public presentation that I'm doing since the launch of the Health and Housing Quality Brief. And I see a few familiar names in the participant section. So hi, Jenny, I miss you. And Anna, it's good to see you again. But yeah, so Sunny Hutton, she, her pronouns, and born and raised here in St. Louis. And home is where our health is. It's the title that we gave this overall project and coalition. It's about strategic and supportive code enforcement, specifically for occupied properties. There's been a lot of work already done around vacant properties through the Vacancy Collaborative, and we actually partnered with them to get this up and running, and we pretty much just followed their process. So we wanted to develop a comprehensive understanding of the code enforcement process and the ecosystem for occupied properties. And we also wanted to look at whether the current resources available or needed to support low and fixed income residents in maintaining a healthy home. And we wanted to focus really on renters, because Homes for All St. Louis, we catalyze tenant associations that serve as an accountability mechanism for landlords to maintain and or improve housing quality. And underneath that umbrella, we all come together to advocate for a more renter-friendly policy environment. Today, we're going to go through like what the problem is, which I'm sure you're all already familiar with, the approach we decided to take, some key findings and solutions, and then a call to action. And when we get into the Q&A section, feel free to ask anything. But I will say, I don't know everything. I am not an expert. I do not claim to be one. So there may be people in this space that know different things about different topics, and we can explore that. Even if you want to know the process of how we brought this coalition of people together to even try to do something like this, we can talk about that. So the problem is something that you're already probably familiar with. If you look at the maps, you see that very similar to maps around mortality rates, health outcomes, education, even potential like crime and violence is concentrated in the areas north of Del Mar. So you'll see like the really red areas. And then southeast St. Louis. So that's kind of like the Patch area, Gravois Park, Dutchtown. So the problem is that we know that living in substandard housing can affect the physical health and well-being of its occupants. And right now, currently, the city of St. Louis sets like minimum standards for healthy homes, and renters are ill-equipped with the tools to advocate for themselves. And usually uniform code enforcement can disproportionately penalize low and fixed income homeowners who lack the resources to maintain their homes. Repeated violations can encourage homeowners to just sell their properties to speculators, under market value. And these are some of the things that we wanted to avoid. We also wanted to avoid the potential displacement of renters due to their homes being condemned, due to it not being, suitable or habitable. We came together, Homes for All reached out to St. Louis, the Vacancy Collaborative, and the Buildings Division. You're probably already familiar with the Vacancy Collaborative. This is a cross-sector collaboration of public and private organizations, city departments, and they're working together to reduce the number of vacant properties and the negative impact that has here in the city. And then the Buildings Division, they're the ones that set the building codes, they issue the building permits, and they conduct building inspections. This is typically an unlikely pairing because Homes for All is a Black-led grassroots organization. We believe in Black liberation, dismantling capitalism, and there's usually kind of like an adversarial relationship between grassroots organizations and municipal actors, because grassroots organizations are usually on the outside pushing for change, and we usually have a set of demands that we want to be met. And so we hold that bar and we set that standard until the municipal actors meet that demand. So it's kind of an odd pairing for us to be working together, but we actually came together pretty easy peasy with the Vacancy Collaborative kind of serving as like this mediator or in between, and other key partners like Lord Ginn being able to communicate with the Buildings Division Commissioner, Frank Oswald, at the time, that this was something that they would want to be a part of. And lo and behold, the Buildings Division and the city was like, we actually do need this. We do need to rethink how we do our code enforcement. But underneath this umbrella, we all came together. We decided on what our values were. So we came up with a set of values, and we also came up with a decision-making model. So we expanded from just those 3 partners to all these people you see here. This is like an image of our network map. On the community side, we had SLACO. We actually had renters on as a part of the coalition. We had homeowners as a part of the coalition. And we actually stipend those renters, the homeowners, the neighborhood associations to participate, because we already have the city who gets paid to do this. So we wanted to make sure that residents could actively participate in it because we needed their opinion and we needed their perspective in this process. And then on the government side, we end up bringing in the Department of Health, the City Councilor's office, specifically their problem properties unit, the president of the Board of Aldermen's office, because we need the legislative part to be a part of it, SLDC and CDA, because we needed the funding behind it if we were going to push forth some of these recommendations. And of course, the political will and buy-in of the mayor's office, especially in the operations part, because they would know if these solutions are viable or not. And then the St. Louis Area Agency on Aging, we actually brought them in because we needed the perspective of how this work impacts our elders. Some of those fixed income homeowners that we talk about are mostly elders. On the public health side, we brought in Human Impact Partners, Ohio State, Change Lab Solutions. All these different partners provided some type of technical assistance, whether it was helping to draft the report, looking at preemption to see if any of the recommendations we bring forth are going to be preempted. And then the University of Memphis, their Strategic Code and Enforcement Management Academy, provided a lot of technical assistance to our Buildings Division and the Department of Health to see how they can better collaborate with one another. And we also had some peer learning so that they can reach and learn from other cities who have already done things like a rental registry or proactive rental inspection. And then we wanted to bring in our nonprofit partners, of course, and then practitioners who are nonprofit developers, people who actually have to deal with the code enforcement process. So DeSales, North Newstead Association, DeSales is on the south and North Newstead is on the north. So we wanted to make sure that we had both perspectives present, DSCC and the Green Building Council. So yeah, this is our big happy family. This is the approach we decided to take. We started off with process mapping of the code enforcement process to identify pain points. Process mapping is literally just saying how do people first, how do we know that there's a violation in a home? And our approach here in St. Louis currently is that the resident has to call Citizen Service Bureau to communicate that there is a potential health code violation. And then the city gets that, routes it to the correct agency, whether it's the Department of Health or Buildings Division. And then they call the resident to set up a time to inspect the property. So we walk through that entire process. What happens from when that call comes in to when the inspector gets it to when they identify a violation, and then what's the penalty for that? Then who does it go to from there? So we went through that entire process for the Department of Health and the Buildings Division and identified pain points. And we had everyone participate in that process. We also did some peer learning and best practices research. We got to figure out what other cities are doing since we don't want to reinvent the wheel. We can learn from other places. So the Strategic Code Enforcement Management Academy at the University of Memphis, we took city staff, and then we also took residents so that we were all learning the same thing, right? And we can all be in that space together. And that's where we also got to meet other cities who have done what we're trying to do. We did some data collection and analysis of the health and housing quality data. The data that we got was local city health data. We received data from the Citizen Service Bureau, the Buildings Division about housing code violations. And then we also got some state health data around like asthma, chronic lower respiratory disease. And then we took data from like the American Community Survey. We have some like self-reported health data as well. And we did some analysis of all of that. And then we moved into our brainstorming process where we were trying to figure out like, okay, now that we've identified what the problems are and we have the data to support it, we've seen what other cities can do, what should we be able to do? And so here's a little image of it, right? This picture here, and I can send you all this PowerPoint presentation. This first one on the left is this is the process map. This is what the process map looked like. It starts off, I clicked on the link and so it gets big and went to another one. But where did that thing go? Okay, so it's this here on the left side is the process mapping. So let me zoom in so you all can see it. So it starts off here where the resident submits, right there, the resident submits an online or phone service request to the citizens, and it goes to the Citizen Service Bureau. And then the Department of Health receives it. And this service request is assigned to a trained environmental health officer or an inspector, and they're assigned based on ward. And then it goes, and then that Department of Health inspector contacts the resident to schedule the inspection. So this is the type of process mapping we did just to break it down piece by piece. We even have the specific code violations that the health department covers. And then it even goes into what if it's an individual owner, or what if it's like an entity owner, like a corporate owner. If it's a multi-unit out-of-state entity owner, we went into the fine details around it and then picked it apart. If you hear barking in the background, it is my tiny dog. And then here up on the right side is some of that best practices research we did. We wanted to look at, we looked for themes within the research to see what was apparent. What were some of the common things that you saw that programs or policies in other cities contained? Did it help with anti-displacement? Did it improve housing quality and compliance? Did it reduce negative health outcomes? And then we have those references here on the right side for like examples in other cities. And like I said, I'll shoot this to y'all so you'll be able to like go through all the fine details. We had a lot of debate around enforcement. How are we going to enforce it? Because like, are fines truly the way to do it? But fines can be a way, but not when the fine is like cost less than it actually costs to mitigate or remediate the problem. So yeah, I'll pay my $25 fine and get it over with. Um, but I'm not coming into compliance. So we looked at enforcement tactics and see what's the time and cost related to some of that, to some of those enforcement tactics. Some of the high level findings that we derived from the data, some of the top interior housing code complaints are for lead, mold, pests, rodents, and plumbing, all things that impact human health. Zip codes with the greater housing code violations and reported negative health outcome are highest among majority Black neighborhoods located in North St. Louis City and South St. Louis City. And I'm telling you, I feel like I'm like preaching to the choir because this is nothing new to us. Black children in the city are nearly 4 times more likely to experience negative health outcomes, such as elevated blood lead levels, like lead poisoning. This is information that was mentioned years ago in the Equity Indicators report. And at that time, it was like Black children are 10 times more likely to go to the ER for asthma triggers than their white counterparts. Data like this was also mentioned in the Forsake of All report, where you saw mortality rates being higher amongst Black folks just across the Delmore divide. When we looked into our ecosystem, so basically, I feel like this research only kind of it echoes what has been done in the past, but still lifts up the fact that these are still pressing issues. In our ecosystem scan, we found that only one organization provides home repair for renters, and they do small things like locks and doors and windows, anything like security related. And we also found that home repair services are unavailable in other languages. So even if there are issues facing other communities or ESL communities, they can't access those resources because it's not in a language in which they can understand. And when we did the process mapping, here's some of the pain points that we identified. It was pretty duplicative pain points across the Department of Health and the Buildings Division. One being that it's a resident complaint driven system. The onus is on the resident to report it. So that means the city doesn't even know what's happening with the rental stock unless a resident complains about it. The inspector assignments are seniority based. So what we see is that inspectors who have more experience are more likely to choose the like least problematic areas or the areas with the least complaints, whereas new inspectors are, thrown to the wolves. We also saw that there were little to no violation fees. So here's a quick fact. The Department of Health, by ordinance, can have violation fees. However, operationally, they're not set up to receive violation fees. So they have not collected fees. Another kind of like foundational pain point that we found was that the inspectors did not have owner contact information, whether it be a phone number or a mailing address. So it was up to the inspectors to go research to figure out who the owner of these properties were. That meant they had to go onto the Secretary of State website. They had to Google became their best friend. the reality is it's not realistic for our inspectors to be researching who owners are. They should be spending their time inspecting. We also found that there was no tenant communication. The tenant or the resident is usually the one that informs the city that there's a potential problem, right? They're the one that contacts the Citizen Service Bureau. However, after that inspector comes and does that inspection, and the inspector can confirm that there is a housing code violation, they don't tell the tenant. In order for the tenant to get confirmation, they have to sunshine request the city and pay a fee, which is completely unrealistic. And renter evidence is also not accepted. So if an inspector comes and they're like, and let's say this inspector comes to the daytime and says, I'm not seeing any evidence of bed bugs. And the resident says, you don't see any evidence of bed bugs? I've been able to pick them off. At nighttime, I get bit by them. I'm able to pick them off, and here's my pill bottle of bed bugs. The inspector can't take it. The inspector can't use that as evidence towards their case to say that there's a housing code violation. We actually found this kind of problematic because certain rodents and pests have different mating patterns. And if you come during the day, you're not likely to find bed bugs. It's at night when they come out for feedings. So just a couple images for you all to see. On the left side, our first map is where you see the majority of Black residents, where the concentration is. And then in those areas is where you see the most like Citizen Service Bureau requests for lead, mold, and pest. And then when we go into chronic lower respiratory disease and those ER visits, it's still concentrated in those same areas. And the same goes for asthma. These are some of the solutions that we came up with. I'm actually pretty excited about these solutions because it wasn't a one-sided process. Like I said, it was a coalition it was really a collaborative problem-solving approach with multiple stakeholders that will be impacted by this, that will be and are impacted by these issues, but also the folks who have to do the implementation on these issues. So we started with some recommendations that we thought were foundational to the other recommendations we have moving forward. We got about 23 recommendations. We said we just gonna hit them with 7. Which ones can we win? Which ones are gonna be foundational to getting those other recommendations? Simple administrative solutions for the Buildings Division and the Department of Health. Send a copy of inspection notice of violation to the tenants. The tenants need to know that there was a code violation on their property, so then they can make an informed decision on what they do with their family, instead of them having to deal with these issues that could impact their health. And then being able to collaborate with a community-based organization. We understand that there's tension between, sometimes there can be tension between city government and residents, and there's a lack of trust because that requires like being in relationship. So why not collaborate with community-based organization that already has those pre-existing relationships and can get that information out to those residents more efficiently and effectively than, let's say, city government. City government just ain't built for that right now, okay? And that's okay. That's why you got friends in the community to help you. The third administrative solution was to expand the role of emergency inspectors. Emergency inspectors is already a pre-existing role within the buildings division, but they only come out and they have like a 24-hour window. So they can come out outside of the traditional 9 to 5 hours. But they usually only come out for fires. Well, we want them to come out for those pests and rodents. Because of the difference in mating and feeding patterns, some of those pests and rodents only come out in the nighttime. So we want to expand their role so they can, when there are calls about pests and rodents, that they can go and inspect it. Some of the policy solutions for the Board of Aldermen. One primary solution we had, and we supported this full force, was the rental registry. The rental registry is just a database of homeowners, a local contact, a mailing address, so that the building inspectors do not have to go through all that trouble. Right now, it was introduced in December of 2023, and it recently passed around 2 weeks ago. And everyone is extremely excited about that. We're happy. Right now, it's optional for people, for landowners to like opt into it, but then eventually it will become mandatory. But number one solutions on our the policy solutions that we feel like the Board of Aldermen should enact is explicitly addressing mold in our building codes. The mold ordinance has been introduced and will be undergoing some revisions. Include anti-retaliation. Let me just say this about that mold. I know you are surprised. Mold was not in our building codes. It was not in our health codes. It was, the only thing that we had was you can only look at structural issues. So if there were structural issues that caused that excess water, dampness, moisture, or mold, was through buildings division, and it had to be like a structural issue, like let's say lack thereof tuck pointing that could have allowed moisture to come in, then you could have a violation for like, lack of tuck pointing or something of that sort. But we wanted to explicitly address it in our building codes because of the impact that it has on health. And our city didn't have the training or technology to even test for mold because it was not included in our building code. So this allowed for that. Including anti-retaliation language in renter-related ordinances. So we actually thought that the data that we collected was underrepresentation. We felt that if we had anti-retaliate, folks are afraid to come to report what's going on in their home. One, there's shame related to it, but another thing is that they're afraid of losing their home, especially in this market. So we think that putting anti-retaliation language in these renter-related ordinances would empower residents to come forth and let us know what's happening. Perform proactive and regular and routine rental inspections. This is just, it's just common sense. We saw that this was common in other cities. The proactive rental inspection gives you an idea of just the condition of your rental stock. So then you can make programs or incentives or whatever it may be to ensure that the housing stock is in tip-top shape. And then relocation assistance. We knew that with this new way of doing code enforcement that we might have condemned homes. But even before that, homes will result in condemnation, and it was just up to the resident to figure it out on their own. And we did not think that was fair to residents to have to just figure things out on their own, especially when the reason that their building was condemned was of no fault of their own. And in this market, you have to have first and last month's rent, a security deposit, and all them application fees. And then you can't even find, we saw the affordable housing report card. We're 35,000 units short of affordable housing units for some of our lowest earners. So relocation assistance was a priority for us. The relocation assistance actually was introduced. It's called the Impacted Tenants Fund. We introduced it simultaneously with the rental registry. So it was introduced in December. And it recently went through a hearing. And we had residents show up to share their stories and their experience. We all agreed with the Impacted Tenants Fund. Our only revision, they said that they would seed it for $100,000. But we feel that it should be seeded at minimum of $500K. With the new rental registry, it brings in the old 18th Ward that was initially not under the Housing Conservation District. So we have this little small swath on the north side of St. Louis that would now have to go through housing inspections that have not been inspected for over a decade. So who knows what type of condition that they're in. And then we have about 50% of those households are renter households. So if we think about the 800 households that would be impacted by this new, by going through those new inspections, we want to make sure that those families would be taken care of. So we advocated for at minimum for it to be funded at 500,000. The BOA president Megan Green and the HUD's committee chair Shamim Clark Hubbard and other members of the committee were on board for it to be funded at 500K. So fingers crossed that when we get to the perfection reading on the board of Alderman Floor, there's more funding allocated to it. And if you want to get involved with it, let us system know. So the conclusions of the report is really simple. Our research further supports that housing quality is inextricably linked to racial segregation and the health outcomes of residential housing occupants. And it shows that Black communities are disproportionately impacted by this problem. And the city has to continue to track the racial impact of the code enforcement system and partner with these communities to eliminate these inequalities. And we're gonna have to get better at, our accurate data collection and reporting, so the outcomes of these policies can be tracked. And as a member of Homes for All, a grassroots organization, we're not just making these demands and saying that they should do this, because we understand that this is new for a lot of us. And on a regular basis, we're just trying to get by. So we met with the Missouri Foundation for Health, and they plan on funding our efforts, our collective efforts for the next phase, so the next 2 years. So we'll be with the Buildings Division, the Department of Health, and the City of St. Louis. We're gonna be rocking side by side with them to figure out what implementation looks like on these policies. And I kind of wanted to give you a little image of what kind of like who's been doing the work, because this work didn't start with us. But as you see, the Home Repair Network, which is headed by the North Newstead Association, Green City Coalition, the Vacancy Collaborative, Homes for All St. Louis, these are some of the challenges that we are trying to address: vacancy, housing deterioration, poor health, limited housing quality, and some of the strategies that we've used with research, advocacy, capacity building. And we've come, like the Green City Coalition, Vacancy Collaborative, there's been a lot achieved during this time. No Place Like Home, the need for effectiveness of home repairs among older homeowners was done by the Home Repair Network. That's some good information in there. Now the city of St. Louis has a whole vacancy strategy. There are resources available online for everyone to view. So many policies have been implemented. And I just wanted to make sure that I lift up what's happening in this ecosystem and the groups, coalitions, and organizations that are leading in it. This is the call to action, you guys. If you want a presentation done for your neighborhood, then you can sign up for one. And then you can also tweet about it. This is the tweet, so you can tag the mayor and the Board of Aldermen president and let them know that these recommendations should be heeded. Thank you for your time. Website and email address if y'all want to bug us.
All right, that was a lot of great information and some really impressive work that you and the group have been doing, Sunny. We appreciate that. Let's see, we do have a couple. Yeah, congratulations on your success. So I know we don't have the chat active with bigger groups, sometimes we try to go through Q&A. So feel free to keep posting stuff in the Q&A, and we'll sort through those. But we do have a couple questions, so we'll get to these. And let's see. So the first one that popped up, Sunny, if you have any of this, the question was, is the code violation applicable to all renters?
I'm not sure what you mean by that, Jasmine.
And I can, if you want, I think, Jasmine, I think I can allow you to talk if it's easier. You can unmute yourself. There we go. Do you want to clarify the question?
Yes. Hi, good afternoon. First, I would just want to commend you for all the work that you did. This was amazing. It was very informative, and I learned a ton, especially being a renter myself, and having dealt with a running toilet issue that I'm unfortunately still dealing with and have been dealing with since December. So it's been a fight. But the list of violations, and I know you're going to send us the slides. Thank you. I appreciate that. The violations that's listed in there, are we able to submit to the city or whatever person, I can't remember what it was. Are we able to submit that and then somebody will come out and inspect? Is that for like all renters? Are we able to go through that?
Yeah, that's a good question. Yes, you can reach out to the Citizen Service Bureau. That's for all renters. Let me make sure that I have the correct number for you, because you can do it online, and you can even include like your pictures, or you can just call. So so the number that you would call, I'll put it in the chat, and then I'll also put the website in the chat if you prefer to do it online.
Okay, great.
And I think I'll copy those over to the Q&A, because I think it's but that's perfect, Sunny. Whatever is easiest for you, we can get the information out there.
And will the slides be sent to our email address that we register with?
That is a good question on the technical side that I don't have an answer for. I think there's a way for us to do that through Zoom. I apologize that I don't have the answer for that, but we will do everything we can to make that happen. If you don't get it, and you are interested in having that, then our contact information is on the section's website, and you can reach out to any of us. We'll be happy to do that, but we will. I'll make a note of that now. So,
and oh, folks can't see what I put in the chat. Ain't there some?
Yeah, I can copy it over, I think, Sunny, to the Q&A answer, and I'll do that now.
Okay, thank you. So Jasmine, what he's putting in the chat is the number for the Citizen Service Bureau, which is the city of St. Louis, who will bring an inspector out. And then I'm also giving you the number for the renter hotline, which is Homes for All's hotline. So you can call, and we'll have a local resident who's a renter themselves, but who's trained in this, and they can walk you through how to get your demands met by your landlord. And they'll also provide like templates for you to use, like, and they'll do like a lease interpretation for you and all that other jazz.
Okay, great. Thank you. And it is for like county residents as well, correct?
Okay, so the renter hotline is for county residents. The Citizen Service Bureau is only for the city of St. Louis.
Okay.
That's good clarification. Yeah, your work was focused with the city on this process, right, Sunny?
Yes.
Yeah.
Yes. Okay. And I live in the county, but that's good to know, the renter hotline.
So that information is in the Q&A now for everybody. Great, thank you very much, Jasmine. Let's see, get back to the Q&A. All right, so the next one was, Sunny, what software did you use or find helpful to prepare your process mapping? So I think probably talking about like the, when the complaint was made and who it went to and all that, I think is probably what they were asking about.
Yeah, I'll answer this a couple different ways. So Laura Ginn did the initial process mapping for vacant properties, and she liked to use Mira. and I think it's spelled MIRA.
Yeah, I've heard of it. I'll try to look that
Oh,
up.
Miro, MIRO.
Okay, great.
However, I am pretty old school, so I do everything with a pencil and paper. So I would just be in the meetings, taking notes, asking questions, and I would put everything on paper. And then for it to be like visually acceptable, I used Canva.
Great. I will put that in the Q&A also. All right. All right, let's see. The next question in there is, what is it like to have something adopted? And hold on, sorry for the background noise if you hear any of that.
Oh, there go that little one.
What is it like to have something adopted finally by a municipality or elected officials? Any pointers you can give the rest of us?
Roberta, that's a really good question. I'm gonna be honest. I feel empowered. I feel so happy, and especially knowing the impact that it could have on the lives of others. It's enriching. And additionally, though, when it comes to like pointers I can give, this electeds and municipalities need you. They need your perspective. First of all, most of their time is spent when it comes to like city departments, they're just spent kind of doing the day to day, right? And that's kind of they're really bombarded and overwhelmed with the day to day, especially when they're short staffed. When it comes to elected officials spend most of their days taking calls from residents about things like potholes and just like overall infrastructure. Some so they actually don't really get the time to legislate like they want to. And then they in the city of St. Louis, they have one like legislative aide, and not everybody has one. Have like one legislative aide that supports them, and that aide can be like just an assistant that helps them like manage their schedule and take their calls. Not all legislative aides can do, pull data and do research on best practices and analyze the data and schedule meetings with department heads to figure out what can be operationally done. So like us coming to the city and saying we have the staffing, we have the funding, and we want to be of service to you was like a huge lift off their shoulders. They like so and all we had to do was like convene them and show them and demonstrate that like we're listening to you and we're incorporating what you're saying, and based on the data that we've collected and all that we've done, this is what I heard you say and this is what's possible. And so they really do need us. They need our perspective, and then they need our support. So if as much as you can like pre-bake for them, oh, they're so happy. As long as they find that like, oh, okay, everything that I said is mentioned here, and she's not coming, it's not, it's not it's not tension, it's not, yeah. So they need you, Roberta.
Yeah, so I work for a municipality in St. Louis County, and I will echo what Sunny said. That's what struck me about what you presented, Sunny, is this how much of a partnership it was. And I think all community, all governments probably across the board, definitely when you approach it as a partnership, I hope would be open to that. And we are certainly, like many places, under resourced. So yeah, it seems like you really augmented and that feedback loop and everything that's what struck me. So from a technical perspective, I know you were dealing with the city of St. Louis, so I don't know if about getting things really adopted. That's where I assume, Sunny, another place where you kind of leaned on the city staff then and saying, okay, now how do we see this through? And I assume they helped you with the logistics of that. Is that accurate?
Yeah, when we start forming the coalition, we knew that we needed the folks that legislated to be a part of it. And we initially didn't ask for any BOA staff to be a part of it because the temperature in a room can shift when you have that kind of power in the space. But we did reach out to the policy director at the Board of Alderman President's office, who kind of was a neutral player and who maintained contact with all of the BOA, with all of the BOA staff. So she knew, her and her team knew how to navigate the legislative environment. So then when we did bring these recommendations, they were the ones kind of moving it through the Board of Aldermen to make sure that we can get the number of votes that we needed, and that each BOA person felt informed about what we were doing.
Great. Thanks, Sunny. So we still have some time. If you have other questions, I've got a couple follow-ups if people want to hang on. And Sunny, if you still have time, just things that struck me from it. So just to clarify with the 7 top recommendations, I know you said you had a lot more of that. One of the kind of low-hanging fruit seemed about providing the tenants access to the violation notice, right? So is it accurate then that even if they make the complaint currently, they don't have access to see what the status of that complaint is?
Correct.
Okay. Without doing the sunshine request. That's interesting.
Without the sunshine request.
Yeah. Very interesting. Okay. Yeah, that's sounds like a good fix then. Let's see. And if anybody, I guess if anybody's more comfortable, you can raise your hand and I can allow you to unmute and you can ask your questions that way too. But let's see. So the other question I had was about the funding. Sunny, was you're pushing for the 500,000, right, for the impacted tenants fund. Is the 100,000 level that's coming? I mean, this is probably a silly question, but it's coming from the city budget.
Yeah, that 100K would be it was from some unallocated ARPA funding.
Okay.
So we're saying give us more.
Right. And has there been, you mentioned the impacted tenants fund and the registration, the
rental
registry. Have they been, what type of feedback have you been getting on the other top 7 recommendations at this point? I mean, that's a lot already.
We've been getting recommendations on the mold ordinance, trying to decipher who it should be under, if it should be inputted into the buildings code or if it should be put into the health code. But those and that required a conversation with those departments to see what can you hold at this moment. And although most people would probably think, and traditionally from our research, it typically goes under the health codes, it will be put under the buildings because buildings has the capacity at this point. And buildings is also, willing and ready to take on for it to be incorporated into their building codes. Another one that is not a recommendation listed on this PowerPoint, but is a recommendation, is a part of the 23 recommendations, is kind of an AC and cooling ordinance. Right now, it's not in our codes whatsoever to it's not in our codes to require AC. But St. Louis gets hot. And with a warming climate, and last year we saw consecutive days, over 10 consecutive days of temperatures over 100 degrees. And then, it get humid here too. And we've seen heat-related deaths, mostly north of 64, Black elderly residents. And we can prevent that. And one of the ways in which we hope to prevent that is with this safe temperatures and renters ordinance that will require AC through those warmer months. However, the debate that we're having right now for that ordinance, because it's written, the ordinance, like, you know, like a draft of it has been written, and the debate that we're having back and forth is, what's the temperature? Like, what should it be? Temperature should be between, right now it says 65 to 85, but some of us like 85 is hot.
Yeah.
And seeing the data that we have a lot of youth and families that are affected by asthma, the proper temperature for asthma, 70 degrees.
Mm-hmm.
It can't be any higher than maybe 70, 72.
Yeah.
So we're having debates around, okay, how many rooms? Should it just be one room? But I've spoken with nonprofit developers, because of course they're in the coalition, and their only thing is they feel like it should be all rooms, but the only time that they're like giving any pushback, and I wouldn't even call it pushback, like, because it's a discussion, is when the only thing they're saying is, in an emergency situation where a multi-unit, so units of 10 or more, so real specific, units of 10 or more, or some large complex, the heating, I mean the cooling goes out, and it happens on a Friday. Those days, it's not enough time, especially because most people aren't working on the weekend. It's not enough time for them to be able to get the whole unit up and running and fixed. So they're asking that they are able to supplement in those emergency situations for multi-unit properties, supplement with like a window unit that maybe will only cover one room, but only during those emergency situations. So that's some of the debates we've been having.
Some important conversations, it sounds like. So that's great. Well, I think I'll give people kind of one last chance here while we're waiting, if anybody has anything else last in the Q&A, or raise your hand. But Sunny, thank you so much for sharing all this great information, and even more so for the work that you and your group and the coalition that everybody is doing in the city of St. Louis. It's some pretty inspiring stuff. And if we at APA can be of any help, you let us know, and we hope to keep up to date with what you all are doing. So
thank you so much.
Thank you very much for your time.
I see James is on here. Hi, James.
Good that you see some friendly names. So, but we really appreciate your time today. Oh, James, maybe here James probably just wants to say hi. You raise your hand, James. Were you just waving?
No, yeah, I thought I was just waving. That wasn't me. Hi, Sunny. Good to see you. Thank you so much for presenting.
Thank you. This was James' idea.
Oh, but you did all the hard work.
Perfect. All right. Well, thank you everybody for attending, and keep an eye on our newsletters, and we'll hope to see you at future events. Take care, everybody.
Bye, y'all.
Bye.